You have the floor.
All righty, awesome. Well, good morning, everybody.
Good morning.
Thank you all for joining us today, and welcome to our 5th annual ChicagoCHEC Community Forum. My name is Everardo Tafolla III, and I will be emceeing the event today. We'll give a couple minutes to let folks trickle in, and then we'll go over a few things before we get started. Because I know there's still a couple attendees trickling in here and there. A couple things about myself. I'm a former ChicagoCHEC Research Fellow and a senior fellow in the 2020 ChicagoCHEC Summer Fellows Program. I'm also a student at UIC and majoring in neuroscience. For those of you who may be new to the ChicagoCHEC, ChicagoCHEC stands for Chicago Cancer Health Equitative Collaborative and is a National Cancer Institute comprehensive cancer partnership led by the Robert H. Lurie Comprehensive Cancer Center of Northwestern University, Northeastern Illinois University, and the University of Illinois at Chicago. ChicagoCHEC's mission is to advance cancer health equity through meaningful scientific discovery, education, training, and community engagement. Every year, this forum brings together community members and leaders, researchers, students, and health officials from across the city and beyond to engage in dialogues about the state of cancer in our communities and how, together, we can work towards eliminating cancer disparities impacting our communities in Chicago. Addressing cancer together during COVID-19, the ChicagoCHEC Partnership is the title for this year's forum. The discussions we will be having today and tomorrow, we'll be discussing topics such as the cancer experience during COVID-19, quality of life, telehealth, self-care, as well as highlight ChicagoCHEC's progress over the past 5 years. We have some amazing speakers for you.
Oh.
I think we lost Ever. We'll give him a minute.
Yeah.
And we'll wait for participants as they come in. Okay, I am going to continue. Just to give you some information about today, mostly everyone is on mute currently, and we also are streaming live on Facebook. For those that are on Facebook, please ask your questions. People on Facebook, people will be monitoring that. We also have a link for Spanish speakers live stream. The link is interprenet.world. You would see it over here. That also will be added to the chat. And then also we will have time for Q&A where people will be unmuted to talk. There's also the hand raise where people can inform us that they want to speak. This is just our policy, just to inform you that this event will be recorded, and images and voices will be put on our social media, Facebook and YouTube, just to people to be aware, especially for sensitive information. Also, to give you an idea of our meeting details, we have in front of you for our Spanish speakers, we'll have interpretation by clicking on the globe down here. Please click on that. Currently, we have our American Sign Language. Her video is being spotlight, so you could see her. And then we also have for question and for the speakers during the meeting, here is where the Q&A, please enter that in the Q&A section. Here's the hand raise, and then the chat will be to share information, resources, and the staff team will also be sharing links for different things and questions relating for access to different documents. We also have our full forum website that has the information on the forum agenda for today and tomorrow as well. Then we also have a link to our raffle draw. It's a form that you can fill, go in there, fill it, and then we have some raffle prices that will be, I think, announced at the end of today. And I will check to see if Ever is back with us. He is. Ever, can you hear us now?
Hello, everybody again. I apologize for the technical difficulties. These are the times we are living in. But yeah, thank you so much, Beverly, for taking over. But yeah, we put down a couple of the ground rules so now we can move on to our next speakers for the session. So I will now briefly introduce our next speakers in this session and then pass the mic over to Ms. Joanne Glenn and Henrietta Barcelo, who will be giving some opening remarks. So for our welcoming remarks, Joanne Glenn and Henrietta Barcelo will be speaking. Joanne Glenn is a registered nurse and is the founder and CEO of Women on Top of Their Game Foundation. She is also one of the co-chairs of ChicagoCHEC's Community Steering Committee. Henrietta Barcelo is also a co-chair for ChicagoCHEC's Community Steering Committee and has previously served as a healthcare liaison at the Instituto Health Sciences Career Academy for the past 20 years, and has been serving the Latino community at large in Chicago. After Joanne and Henrietta, we will hear from Esther Corpuz, who is the Chief Executive Officer at Alivio Medical Center, as well as Dr. Linda Ray Murray, who is a retired physician who has spent her career serving the medically underserved and has been a voice for social justice and health as a basic human right for over 50 years. She plans to devote the rest of her career to being an enthusiastic, full-time troublemaker. She currently serves as a governing council speaker for the American Public Health Association and is an adjunct assistant professor at the University of Illinois School of Public Health. So without further ado, thank you so much for being here. And Joanne, you can get ready whenever, you can go ahead and start whenever you're ready.
Thank you, I appreciate that. So first of all, thank you for letting me in your home, your kitchen, hopefully not your bathroom, or your balcony. I want to get this out the way. We've been, since March, socially distanced away from each other. So if we count April, May, June, July, August, September, October, November, I think there may be a baby boom coming up for December. So I was just thinking of some baby names for December, like Rona, mass, social, distance, and of course the virus. So again, hopefully you're still in love with the people that you're stuck in the house with. Then I was trying to find the best place to sit to talk with you. I knew I couldn't go to 1600. I was going to go to the balcony, but you have those pigeons that have those unclaimed events. So pool wouldn't look good on me. So you're in my home. And again, thank you. Hi, hey, hola, good morning, me llamo Juana. Let me tell you why we welcome into your home and why this is important. You are me and I am you. I've been at RN for 45 years and I've seen a lot of things, the good, the bad, and the otherwise. I've been with CHEC for 5 years and also the good, the bad, and the otherwise. I don't just do this, this must be done. Community involvement is key. I'm working for us. When they go low, we have to go high. Like John Lewis says, good trouble, that's what we're about. I also have an MBA, so I've been blessed and obligated to sit at a lot of boardroom tables to work on our behalf, listening, speaking, and planning on what's best for healthcare for us. Remember, I am you and you are me. Well, it's time for you to do your part. You count. You should be an expectation of not good care, but exceptional health care. Hold your providers accountable. We are due equal representation, equality, and yeah, it's taken a long time, but we are slowly getting there. Listen and listen and be prepared to ask questions. We need your participation this morning. Remember, good trouble, because I am you and you are me. Be ready, relax, sit back, enjoy the morning. No, this is not something we do. This is something that must happen. Thank you for your time. Enjoy your day. Virtual hug, because I am you and you are me. Thank you. Henrietta, my partner.
Okay, thanks, Joanne. You're awesome, babe. So you are, yeah, I am you and you are me. I mean, there's just no question about that these past years since we've been co-chairing this committee. This is the 5th annual committee forum, aims to provide firsthand information and resources from individuals who have the professional expertise and knowledge that may prove helpful to you one day. You may hear today that recovery and access to healthcare can be a challenge for cancer patients during COVID. But what COVID really did was shine a bright fluorescent light upon the deep and profound health disparities that are pervasive between white and other Chicagoans who live in vulnerable and poor immigrant and under-resourced neighborhoods. You may also hear today that was not surprising. You may hear ideas for solutions to complex problems and how it starts with talks and an approach that brings community residents, organizers, community-based organization, academic, and health experts to lay out a plan how to address equitable access to same opportunities and resources for everyone. You will hear that challenges are very difficult to solve, such as this one. A 53-year-old woman currently living in Chicago. She has been in the United States for the past 15 years, but does not have legal immigration status. She's been working as a nanny in an informal employment relationship that does not provide health insurance. After seeing a flyer for a free breast cancer screening, she visits a municipal clinic for a mammogram. The mammogram reveals a mass in her breast. The municipal clinic is unable to offer screening through a federal, was able to offer the screening through a federal program, but unable to provide treatment. This woman has saved enough money to pay out of pocket for a biopsy, which shows that the mass is malignant. With the help of her family, she's able to pay for surgery and staging, which reveals that she has metastatic breast cancer. After surgery, the woman's surgeon recommends that she consult with a medical oncologist and a radiation oncologist about follow-up treatment. At her appointment at the oncology practice, the woman explains that she and her family do not have insurance and cannot afford to pay for additional treatment. She asks whether the clinic would be willing to treat her for free or at a significantly reduced cost. And whatever there are in-source resources she can turn to for additional funds. The woman in the story can be anyone as well as someone we know. So what to do? You are called to arm yourself with the knowledge about cancer health and become the point person in your family for good information. To be unafraid to talk about cancer and take the necessary steps to remain healthy. Schedule those annual examinations for early detection. Be a survivor. Familiarize yourself with clinical trials and why they are important to our community. Vote. Your knowledge, your action, your voice has to be heard by community, city, state, and national leaders that calls on them for policy and legal statutes to be changed. Lastly, the CHEC Community Steering Committee wants to hear from you, your thoughts about the topics and experts on social justice, cancer during COVID, impact on the human spirit, nutrition, self-care using cell phones for medical visits, and health resources. Thank you. We're glad you're here, and we hope you enjoy the conference. I just want to do a little shout out to my colleagues on the Community Steering Committee for all their contributions and time, as well as our academic colleagues, and especially those teams from Northwestern, UIC, NEIU, Alicia, Melissa, Beverly, Edgardo. Thank you. A huge thanks for all your good works. Enjoy the day.
Thank you so much. Next, we will now hear from Esther Corpuz. So Esther, you can go ahead and get started whenever you're ready.
Buenos dias. Good morning, everyone. It's a pleasure to be here with you today and to see that we have at least 77 participants. COVID has caused disruption in our lives, but I'm so glad that even during these trying times that we're still able to have this kind of a dialogue. I want to thank CHEC, your leadership, all the volunteers, and everyone who put this very important program together today. Just to give you a little bit of background on myself, I was born and raised in the Pilsen community. I have been at Alivio now for going on 7 years. It's hard to believe that it's been 7 years. For those of you who, many of you may know Alivio's history, but for those of you who don't, Alivio was founded 32 years ago, or opened its doors 32 years ago, by a very dedicated, fearless, determined woman, Carmen Velasquez, una mujer mexicana, somebody who has dedicated her life to healthcare and to health equity. I know that she's on the Community Steering Committee, and I hope that she's on this call. You know, Carmen saw the need that, you know, our immigrant, undocumented community had no access to healthcare. We were left out. And she was not a healthcare person. She was an educator by profession. But anybody who knows Carmen knows that when she puts her mind to it, she's going to get it done. And, you know, I often say to her, Carmen, you know, the same issues that caused you to fight to have a community health center built in Pilsen are the same issues that we face today. Linda Murray has been doing this for 50 years. And, you know, it's troubling that all these years later, we still don't have health care for everyone. And that is a shame. How could we be closing a hospital during a pandemic? A hospital that serves the Chinese, Black, and Latino population. I'm speaking about Mercy. we have to work together. I'm glad that this group is together because there are just so many continued injustices that are happening to our community. I just want to share a little bit about what we have been going through at Alivio during the pandemic. March 8th of this year was the first reported case of community spread of COVID. It put Alivio into a tailspin, trying to figure out, how we can see our patients safely, separating our sick patients from our healthy patients. I had been trying to launch telehealth for over a year at Alivio, and this pandemic, well, it's had a lot of horrible negative things on our community. It really has brought people, at least on our team, together to work closer together. And within a week, we had telehealth launched, an initiative that we had tried for over a year to implement. But then, we realized that a lot of our patients don't have internet at home or may not have a laptop to have a telehealth visit. So that digital divide that we all know exists in our communities posed a greater issue for us in terms of being able to see our patients. We had to start to do daily huddles with our staff and just keeping in close communication, trying to figure out, who could work from home, who could continue to work at Alivio. Looking at our waiting rooms, it made me sad to see all of our tables turned over because we couldn't have patients sitting close to each other. Beginning our testing at the end of March, since then, we have 2 drive-through testing sites. And, watching the daily briefings by the state and the city where they talked about the positivity rate, but they weren't breaking it down in terms of, how it was affecting certain communities, how it was affecting the Latino community. And so, as I mentioned, a lot of good things have come out of this pandemic, one of them being Unidos Illinois, a group of community-based organizations, elected officials, healthcare professionals that said, we need data. We need data on the Latino community. And since then, we started to meet literally twice a week for long hours, trying to sort through many things. I recall that just one of our calls, there was a young lady, her name is Melissa Martinez, who shared a story, and I'm gonna read a little bit about what she said. Like so many Mexican immigrants, Melissa Martinez Cepeda's parents don't have the privilege of working from home. Both of their workplaces, a factory and a warehouse, continued to operate during COVID-19 when the pandemic struck. Unfortunately, both contracted the disease because after dutifully showing up for their jobs every day. Their symptoms were mild and they are okay, but it has left so much anxiety in the family. This story is not uncommon. It's what many of our patients face in immigrant communities. I'm insulted when I hear people say that we're catching COVID because we're having quinceañeras. It's not because we're having quinceañeras. It's because our people are working. Our people live in closer quarters. They don't have that privilege of working from home. I want to really, again, thank this group, because what we're seeing also in primary care is that I'm really worried, our providers are worried that people are not getting their screenings. How many breast cancers are we missing now that women are not getting their mammograms on time? Our children are not getting immunized on time because they're not in school. Men are not getting their prostates checked. So there will be aftermath after this COVID, and we have to work together. We have to continue having these dialogues. We have to continue to fight together to make sure that we can't accept that hospitals in our community that serve our patients are going to close, particularly during a pandemic. So I look forward to working with each and every one of you. And I know that Carmen is very involved in CHEC, and I hope to be more involved in the future with this group, because I know that the work that you do is so important to the work that I do. And I haven't met Joanne in person. Joanne, I can't wait to meet you in person. Henrietta and I have known each other for many years. And thank you very much for giving me the time and being part of this forum.
Alrighty, thank you so much. And now we'll be able to hear from the wonderful Dr. Linda Ray Mary. So Dr. Linda Ray Mary, you can get started whenever you're ready.
Well, thank you, and good morning, everybody. And thank you so much for joining us on this Zoom conference. It's very difficult. Zoom presents special problems, so you're to be congratulated for coming on. I think Esther and all the previous, our co-chairs have outlined the real problem. I won't take much of our time. I just want to say something about the period we're in and the situation we're in. When I was a little girl growing up in the projects in Cleveland, Ohio, there was a saying, and the saying was, when America gets a cold, the Black community gets pneumonia. That's a saying that I grew to understand as I grew up. Well, today America has pneumonia. So where does that leave us? Where does that leave us in Little Village? Where does it leave us in Chinatown? Where does it leave us on the south and west sides? It leaves us on ventilators. It leaves us in dire straits. And so what I wanted to emphasize to you is that you know a lot. In fact, you know the most important things there are to know about this pandemic and how it's impacting real people in our communities. This pandemic is not a surprise. It may have been a surprise to the president. It's not a surprise. Everybody who keeps track of these kinds of infections knew that it was only a question of when we would be hit with a new virus that had never been in human beings before, that spread easily through the air, and that killed people. And so the reaction of the world is not what we should have done. It was slower than we would have wished, and it's not quite as coordinated as we want. But in our country, what has happened is really a crime. The response in the United States has been more than inadequate. We now have one of the worst rates of death from this virus than any other nation in the world, and we are the richest country in the world. I don't want us to forget that the root causes of this particular pandemic comes to us because of climate change, that the fires that are going on in California and the hurricanes that are accosting us on the Gulf Coast and this virus are all related because they're upsetting the planetary ecosystem. And that's why it is that viruses that normally stay within bats or other animals have spilled over into the human population. And so if we understand that the causes of this pandemic are worldwide, think about how quickly it spread throughout the whole world, then the solutions to what we must do have to be worldwide. And while I'm not going to talk about this in detail today, just be clear that any vaccine, any treatment, any approach we have to control this particular virus has to be done across the world. If only rich countries implement a vaccine and ignore the poor countries of the world, then we're going to fail because the virus will not be defeated. But let's talk here, what's going on in our country. And I think Esther has laid out what we all know. Real people, ordinary people, our people are essential workers. That's a word that was never used before. Now, we're not talking about just the essential workers of our doctors and nurses and hospital care workers that were very heroic, especially during the first surge. I'm talking about the real people that run our city, the people that drive the buses and sweep the floors and clean the hotel rooms and make the food and serve the food and stock the grocery shelves. We know about these people because they're our community and they are mistreated and underpaid. How is it possible to be an essential worker and still have to get food stamps? How is it possible to be an essential worker and not have health care? So when we think about the impact of COVID on our communities, it's devastating. If we look around the country, we could tell you without waiting for the numbers from CDC who was going to be in worse shape from this pandemic. It's not a surprise. The group that has had the worst experience in the country have been Native American indigenous people on reservations, where 80% don't have running water. That's not a surprise. And in our cities, in our community, it's people who go to work every day. The Latinx community, the Black community, Asian community. Wherever you find people going to work every day, riding buses and L's, working in low-paying jobs, not given appropriate protection, you're going to find more disease, more people in hospitals, and unfortunately, more people dying. And what Esther said about having regular diseases that kill us normally, like cancer and diabetes and high blood pressure, not being able to be attended to because we've had to deal with this emergency pandemic, it does concern me as a physician. And so we are being bombarded from all sides. People are being laid off. They're losing their health insurance. People that never had health insurance may lose their jobs. When the rules fall apart for evictions, we will see more and more homeless people. Our children, our babies, have not been able to go to school. In the spring semester, when the schools closed and tried to do distance learning, 60% of our children never signed on once. 60%. And what happens in this next semester and in the spring semester when we are not bringing this pandemic under control? We have to understand that COVID-19 has just ripped off the covers of a country that is unequal and unjust. It's ripped the covers off of the racism and discrimination, the anti-immigrant attitude that exists in the nation that has been growing. It's not an accident that people are in the streets because of George Floyd and other murders. It's not an accident. It's not an accident today at the University of Illinois that the nurses union and SEIU, Local 73, are on strike, calling for more protection on the job so that they can take care of us during this emergency. So the solutions we already know. It means that we have to get in action in our churches, on our block clubs, in our community organizations. We have to stand up and say clearly what we need. Within the first 100 days of what is hopefully a new administration, we need to pass single payer in the first 100 days. Every other nation is able to provide universal coverage. Every other rich nation is able to provide universal medical coverage to everyone that lives in the country. We can do that too, and we can do it quickly. We don't need to drag it out, especially when a pandemic faces us. It is a crime that we're losing our oldest hospital in the city. Mercy Hospital was the first hospital established in the city of Chicago. It is a faith-based hospital dedicated to taking care of people. And they simply have not been able to survive in a medical system where we act like hospitals have to make money. That's why they're closing. In what universe would that be? Where do we think people should be able to make money off of people that are sick and suffering and dying? Healthcare is a basic human right, and we have to stand up and fight for that. Schooling for children is a basic human right, and we have to stand up and fight for that. Being housed and having a job with dignity that's safe are basic human rights. If we fail to come together, if we allow our communities to be separated, if we fall into this trap of thinking that your interests are different than my interests, then we'll lose. But when we step back and understand that all of us are concerned for our elderly family members, that all of us are concerned about the lack of education that our children are getting, if we realize that if we demand what we know we need, not what we think we can get, but what we know we deserve as human beings, then we have some hope of making serious changes in this country. I want to echo the person who said earlier, vote. But voting is only the first step. It's a little tiny step. It's not enough by itself. We have to vote and vote repeatedly, and we have to take the people who work for us, the people we elect, and force them to make the changes that will save your family and mine. I hope you ask questions during the rest of the day, participate, give us some ideas on other things we can do to address cancer inequities and how we connect those problems that we have with cancer with our other health problems. And I look forward to hearing your ideas and thoughts. Thank you.
Thank you so much to our wonderful speakers and for those wonderful words, for their warm welcome. I know that there was a question in the chat earlier. There was a hand raised regarding the raffle. If you are on Facebook, we will be putting information for the raffle later on. So keep an eye out for that. But now, thank you so much to our speakers. Now, Joanne will open up a conversation focused on the community and patient perspective of cancer care during the COVID-19 pandemic. Here with us today, we have Rosa Miranda, licensed practical nurse and clinical supervisor at Norwegian American Hospital, Tasha Joyner, founder of the Tasha Joyner Foundation, and Candace Henley, founder and chief surviving officer of the Blue Hat Foundation.
So it's been a great morning. I'm going to drop the mic for Dr. Linda Ray Murray and say that the 82 people that are online still have a chance to write in #1 leader. Thank you, Dr. Linda Ray. You hit home. All right. We have a wonderful panel, and I'm in expectations that we will get some great information shared. So I'm going to open up with Rosa. If you would tell us a little bit about yourself, some of your experience, and how COVID has affected you, your family, loved ones, and how you're dealing. Rosa, can you get started for us?
Good morning, everyone. First of all, thank you for having me and allowing me to join your panel. This is a very difficult topic for everybody right now due to COVID, and unfortunately for those of us that have been dealing with the struggles of having to deal with both COVID and added on to all of that, the cancer has been a very difficult struggle. I have been working at Norwegian for over 27 years now. Throughout all this time, it's been very difficult. We've seen some ups and downs, but never has anything hit us as hard as what we're facing right now. Unfortunately, throughout all of this, I've been dealing with cancer myself. Also, just recently, we've had a horrible experience in our family where my mother has been recently diagnosed with cancer. And it's been a real struggle trying to get through to her appointments because unfortunately, you know, cancer does not wait for anybody or for the COVID to end. So we have to face it in a whole different way. It's difficult, but it's manageable up to a certain point once we understand what we can and cannot do. Through all of this, we have to remember that we have to keep scheduling our follow-ups, that we have to keep, you know, taking care of ourselves, because even though we're all scared to be exposed to this horrible virus, life continues, and we have to face everything else that comes through our way with, you know, with our head held high. Taking cautious, of course, and being careful as not to overexpose ourselves, but at the same time, we cannot hide away from this. We have to continue living. So again, thank you for having me here, and I'll be happy to answer any questions that I possibly can.
Thank you so much, Rosa, for sharing, and continue blessings and good health to you.
Thank you.
All right, my love. So next I'm going to have a couple of butterflies from the Tasha C. Joyner Foundation, which I helped to find and mentor it. I think we have Gail Briggs on the line, and who else is there? I had a couple of people that I asked. I'm going to ask the butterflies to speak up, and if you can tell us what a butterfly is and share some experience on how you're dealing with COVID and cancer, that would be great. Have any butterflies on the line?
Yes. Hi, good morning. Can you hear me?
We do.
Okay, my name is Gail Briggs. I am a 13-year breast cancer survivor and also a butterfly advocate. I am thank you, Joanne, for allowing me this opportunity to kind of speak on behalf of the butterflies and COVID and treatment during COVID. We do have one of our members right now who had metastatic breast cancer, and she was going back and forth to the hospital because she didn't have enough money to actually pay for her medication. She was in between disability application, and with that, she didn't know she was supposed to apply for Medicare for her insurance. So she went to the hospital, I don't know, at least more than several times, because she had problems. She had fluid on her lung, and that was due to the breast cancer, part of the breast cancer, and she wasn't able to afford her medications. That was the long of it. So she had a drain put in to drain the fluid out, and she was always short of breath, and she was always, like I said, going back. I'm sorry, can you guys still hear me? Something happened with my phone. Are you guys still there?
Yep,
Yes.
we can hear you.
Yes, we
Okay,
hear you,
I'm
yes.
sorry. Okay, and so long story short, another butterfly, Verna, and some other, we are our sisters keepers. And what we did was we pulled together as many resources as we could to assist her. The doctor started treatment again, and she was back in the hospital, unable to walk. She had edema from waist down, swollen legs and ankles, and she was walking on a walker. And she was able to call the doctor's office, and thank God they had a social worker in the office that assisted her. Other than that, she was afraid. She had to get COVID tested every time she went to the hospital, which was more than 7 times. And they did the nasal swab along with her not feeling well and not being able to breathe. She had to endure that. So thank God right now she is better. She did get a social worker from her doctor's office who helped to get her Medicaid insurance because they had denied her, saying that she had too much money from disability. So she does have Medicaid now. I did try to get her on with Illinois Breast and Cervical Cancer Program, and she was just unable to really help help herself as far as calling these places and finding out. But she did get a social worker through her doctor's office, and thank God for Verna also. She sent her some resources on how to get a homemaker or someone to come in and help her clean up, someone to help cut her grass so the village wouldn't give her a fine, because those things she wasn't able to do and she was concerned about. And she did have caregivers, but sometimes it's how we raise our children, when we think we're so independent and we don't allow them to help us. So that was a challenge too. But thank God I went to visit her. I took her some ice cream she's eating. That's a good thing because she lost a lot of weight. And I took her some flowers to kind of cheer her up. So it's been a challenge for her, and she couldn't have any visitors while she was in the hospital going through all this. So no one could be there to support her. So that's another profound thing that, is really hard while you're going through any type of treatment. So again, I thank you for listening and hearing my story. And if Verna Stinson want to add some things, she can, because she has some great resources on Zoom and how to exercise. Thank you, Verna, for sending me that. I never got a chance to do it, but I appreciate it. So if you want to add to anything, and thank you,
Gail.
And
so
Chet.
thank you, Gail. We do have Butterfly Verna Robinson on the line, and Verna is such a delight. Verna, please share some of your stories regarding how you managing as a survivor and one of the butterflies during COVID. That would be great.
Okay, hello. I'm serious. Something happened to my PC. Give me 1 second. There we go. Hello, everyone. It is a blessing to be here and to talk about being a butterfly and a little bit of my story as a survivor and a Tasha C. Joyner Foundation butterfly. And hearing from my sister Gail, just hearing her voice, because like you said, during this COVID times, we are not face to face and our connections are limited, but we always reach out and touch by text and phone calls. And when we get this extra where you can see the face, it's just great. It makes a butterfly heart, and I think all of your hearts flutter, flutter, as we say. But as being a butterfly, I'd like to talk a little bit about not only our sisters, but what a butterfly has meant to me in my journey. A butterfly, wow, it gives you life, it gives you hope. And what I learned and what I wanted to share with you as a butterfly and also as a person, a butterfly, we come to learn that we are our sister's keeper. So as Gail was talking about the story of another butterfly, it's true. No matter who you are, no matter how long you've been a butterfly, we reach out and touch because we are all connected. We are each other's keeper. And I could tell you so many wonderful things, and I'm probably going to just go all around and hopefully I'll come back to the core. But being a butterfly, when you first diagnosed with hear the word cancer and you receive that diagnosis, it's devastating. It just stops you in your tracks, and it's like someone cuts off the lights. But when there are organizations like the Tasha C. Joyner Foundation out there, it helps you. It gives you hope. It gives you direction, and it just leads you right through the tunnel. And you don't have to find the Tasha Joyner C Foundation or find the butterflies, they find you. It's some kind of miraculous way, whereas God plants your feet right in the right space at the right time, or your thought in another pinky sister, as we call breast cancer survivors, that connects you through the organization. And I just thank God for the Tasha C. Joyner Butterflies and the W.O.T Foundation, W.O.T, Women on Top of Their Game, because it changed my whole journey and my perspective and all of our perspective as the butterflies. And it doesn't just stop and begin or end with us, because we are our sister's keeper. We reach out and we touch so many people, not only butterflies, but friends and neighbors, and you become known as a butterfly, a breast cancer, a cancer advocate, and you help everyone through their journey. Because why? We are our sister's keeper. And as Gail said, as going through this journey, you learn about resources, and we share that information. You know how it feels to walk through that cancer journey tunnel. So what we do is we reach back and we pull up our sister, our fellow cancer fighter on their way to become a survivor, and we make sure that we don't drop the hand, that we hold on tight, and we bring them through. And I just can't tell you what joy that is to know that when you're fighting cancer or breast cancer, to have someone like a butterfly, a fellow breast cancer survivor, who can walk that journey with you. And that's what the butterflies do for you and for everyone that's known and affiliated with them, or for anyone. You don't have to be a butterfly. We are here to help everyone. So being a butterfly is so much I want to tell you about. It's a very different organization. We are all survivors. We learn through the butterflies how not only to survive, but to how to embrace the journey, to live the life, to share your testimony and your story so that you can help others become survivors, thrivers. And what we do at the Butterflies is we celebrate life. Whether you're going through your journey right now, or whether you're in a hospital, or where you're at home and you may not, especially in this times, may not be connected with anyone, we are there for you. We are there for our sisters, because we use the technology that is here, Zoom, text messages, phone calls, whatever means it may be. And you're at different points in your journey. Sometimes you cannot speak, you cannot talk, you don't even have the strength to reply back. But when you look at your phone and you see that there's a message from a butterfly, from Madam Butterfly, from Joanne Glenn, who we affectionately know and love and call JG. It just gives you what you need to go on to fight, to conquer this illness, to kick cancer in the rear end. And that's what we do. We are our sister's keeper. And I get emotionally charged when I think about what the Butterfly Organization has done and what the Butterfly Organization means to me, and how, because of the breath, the life, the that was given back to me after a battle with cancer, how now I, little bitty me, one what I call insignificant matter on this earth, can go and reach out and give hope and inspiration and encouragement to a fellow sister, a breast cancer survivor, a breast cancer fighter, and to how to embrace life after you go through cancer. And as Gail has described some of the devastating effects and what you have to go through, as the young lady in the story that she shared with everyone, you can sink into a depression, you can lose your grip, you can lose hope, but we flutter about to give everyone hope, to give them that inspiration, to give them that will to fight when they can't see their way through the dark turning. We let them know that this too shall pass and you will come to the other side. And when you come to the other side, the Tasha C. Joyner Butterfly Foundation will show you what our theme is, and that's celebrating life, because every day is a blessing. And in this journey, in this dark journey, it's not the end of all. It is the beginning. This cancer journey can help you to realize how important life is. It can help you to realize and to use the gifts that God has given you, and to know that everybody has a gift, and that you can be that comforter, that supporter, that encourager, that motivator for the next person. You can make a difference, and you can help them fight to win, fight to win the fight against cancer. And it gives you joy that you can do that. But it's because of being in organizations like the Butterflies that we found our voice. We found how to give. We know how to reach out and connect with sisters and to share the resources. Because when you go through a cancer diagnosis and journey, you don't know where to find resources or who can help you or what kind of programs are there. And Gail is right, there are programs that are available. And one that she had referenced was through the Cancer Support Center, where not only that is an organization where you would normally go to one of the two locations, and there are other support centers around, but I bring that up to tell you that the more you know, the more you can share, and the more you can share, you can help everyone grow and grow to get through this destination and this journey of life. But they have provided services through the pandemic, which are virtual, Zoom, and online. The Tasha C. Joyner Foundation is continuing to do exactly what we did before the pandemic and pre-COVID days, where through our network of sisters, as Gail says, you show up, you provide whatever encouragement or light that needs to be given to a butterfly in that stage, whether it's flowers, whether it's a note, a card, whether it's a stuffed animal or food or the hard to find sanitizer. When that was so hard to find, there was no worry. The butterflies were knocking at your door and they were giving those supplies. They give so much. And I'm sorry. I know I could talk on and on.
That's okay. We appreciate the information, but what I want to share with you, and I think we have one more butterfly before we go to our last speaker, is you are not insignificant, my sister. You are appreciated. You ladies that are helped to navigate through the healthcare systems do not look like what you've been through. And I am blessed to be able to assist, and thank you for all your kind words. We appreciate it.
and thank the Tasha J. Joyner Foundation for teaching us and giving us back life and a zeal for life and able to share with others.
Thank you, sweetie. I think Elizabeth, Alicia, are you on the line and able to speak for a few minutes?
Yes, I'm on the line.
All right. Can you give us a few minutes of your journey and what the butterflies be before we end up with Candace?
Sure. First
Thank
of all, my name is Elizabeth Rivera. I was diagnosed with breast cancer in 2012. It's been a while, so thank God I don't really remember the date, which is weird. I do remember October 13th, but not the year. Anyway, a butterfly is someone that evolves. And so in being a butterfly, I've evolved in so many ways. So when this Can you hear me?
Yes,
Yes,
we hear you.
we hear you.
Sorry,
Yes.
something happened with my computer, so has to start your video. I'll start my video. Okay. So when COVID was breaking news, I went into anxiety mode, and not just for myself, but for others that I knew that was in the same position as I was. Our immune system is low. How do we handle this? Do I have enough supplies? Sadly, we were scrounging around for supplies. We are, I went into the emergency mode. I'm a mom, I'm a cancer survivor, so I went into emergency mode. I started compiling an idea to make sure that all the butterflies had enough supplies. Either we had masks, we had hand sanitizers, and believe me, I had to find gallons and pour them into different containers because there was no resources. So anxiety was very high. While COVID is still out there, I feel a little bit better. I have lots of steps in place for myself. I am an essential worker, so I take care of children. So I'm at high risk when children come into my home and they leave and go into their homes and then return. So I am very careful with everything that I do. And so with all this experience trying to deal with COVID now, which I don't have a lot, but what I have, I like to share with my butterflies. So just to say that I'm still in anxiety mode, but not as much. I know that this will all somehow work itself out, but we must work together, and we must not be afraid to see our doctors. Like flu season is coming around. We must encourage our sisters and brothers that are dealing with cancer to get our flu shots and continue to live our lives. So I thank you everyone for letting me to participate in this conference. I've learned a few pointers just listening to the others, and I'm very privileged to be here. Thank you.
Thank you, butterflies. We appreciate the knowledge, the love, and see you soon. So last but not least, another powerful survivor. I'm going to ask Candace. She's a Chief Survivor Officer of the Blue Head Foundation. Share your story regarding your journey and COVID.
Hi, thank you, thank you. Some powerful testimonies from the butterflies, but I'd expect nothing less. I was sitting back here going, amen. And so for me, I'm a colorectal cancer survivor, and I was diagnosed at 35. And so that journey for me 17 years ago has been one of not so much the physical side, but the financial side, which is something that a lot of people don't talk about, or they weren't talking about it then, about the financial toxicity of cancer. And I understood that, because a lot of people, don't want to talk about because of embarrassment, and B and C, because it's nobody's business. But it leads me to why I started the Blue Hat Foundation, because when I was diagnosed at 35, a mom with 5 children and great insurance, everything, but there were no resources available at the time to assist me at all, because colon cancer in 2003 really wasn't on the list of cancers that were supported by, certain organizations. And so, and every time we turned for resources, there weren't any resources available, or I wasn't sick enough, as if the word cancer itself doesn't make you sick. And so, and I'm speaking, the way I'm talking about it now is hindsight, because during the time that I was going through it, I didn't understand any of this. And when you're in the midst of a fight, for your life, and then you have to find resources, and you're fighting to stay in your house, you're fighting to keep everything you worked hard to, to earn, that's a whole nother level of an emotional trauma, mental trauma, and that led me to, attempting to commit suicide, because at that point I had nothing left. I was homeless with 5 children, and the only financial avenue that I had was insurance that I knew would take care of my children with them and someone else. But I wasn't successful with that, which has led me to making sure that no one else in my position feels as if they have no other avenues for life. And so the Blue Hat Foundation was formed as a result of my cancer journey, not having resources, not having, any type of financial connections or, resources that could help me with helping me fill out applications for Social Security, helping me information. I didn't even know that when I filed for Social Security, I could have appealed it, but I didn't have that information. I didn't have the mindset. My mom was diagnosed with COVID-19 earlier this year, and that was such a stressful time, because prior to that, she also was diagnosed with Bell's palsy. So we didn't know how COVID was going to affect her. And she actually had a very mild case. She survived it, thank God. But although she was still very sick, she wasn't as sick as a lot of people that we've seen on the news and we've heard about. She didn't have to be hospitalized. She had to be quarantined at home. And so that meant that we had to actually figure out ways to assist her, from, going to the grocery store, to doing laundry, to preparing food, to making sure that she had doctor's appointments and medications and things like that. So we had to become creative in ways of how we entered the house and how we exited the house, how we made sure she had things. And so those are challenges that you face with loved ones, with COVID, and being a cancer survivor myself, I also had to protect myself. And so, but that was my mom. And so whatever that needed to be done, we were going to do. So these are the challenges that we're facing. And then patients, and dealing with patients that are in active treatment, but fearfully not wanting to continue treatment because they had to go into the hospital. And so, at the foundation, we were encouraging patients to continue their treatment, and that the hospital was actually one of the most safest places for you, because of the fact that they weren't letting any, outside people in other than patients, and encouraging them to continue their treatment, because we know that patients in active treatment, they need that treatment. And especially with colorectal cancer, and some of that are in stage 4, which is very aggressive, with some colon cancers, especially young people, making sure that they continue their treatment, and understanding that even though we are in the middle of a pandemic, you still need to protect yourself. You still need to continue treatment, and to encourage them to have the conversations with their physicians when they felt uncomfortable, not to just, discontinue treatment, but to find out if there were options. And so we were able to find options where there were nurses that were able to come to the homes of the patients, of course, in hazardous, uniforms, but we actively help patients continue their treatment and encourage them to continue continue treatment during the pandemic. Myself recently just got out of the hospital for colon cancer related issues, and wind up having 3 different bacterias that we knew, but it wasn't from the hospital. It was from the fact that it was gut bacteria, and the operation I had was on my abdomen. And so and that was a time where I was like, okay, I have to have this surgery. It's a life-saving surgery. And I knew the risk going in, but I also knew that quality of life was important. And so I made a decision that even though during a pandemic, I still needed to live and I still needed to have a quality of life. And although I had the 3 different bacteria strains that I was fighting, I still felt that the hospital itself did everything they could and everything to make sure that I survived, and everything to keep me comfortable and to make sure that whatever it was that I was fighting, they were on top of it. And so I never felt as if anything that was going on in the hospital was something that I feared for COVID. And so then, which is one of the things that I encourage patients, is like, fear will kill you because it will keep you from doing the things you need to do to save your life. And I say that because I just recently lost my brother from fear of not maintaining his health and going to the doctors on time. And so he's my younger brother. So this is very personal. And so I want to encourage anyone, if you're fearing going to the doctor, don't do that. You have loved ones that love you. You have children, you have grandchildren, and they need you here. Fear is a killer. Fear of the unknown. None of us know when we are going to die. So to fear screenings, to fear life-saving medical procedures, don't do that. Don't do that. And so that's just my message. And so thank you for having me on the panel, and I look forward to continuing the discussion.
Thank you so much. On behalf of CHEC, I would like to thank all of our panelists, because we are you and you are we. Thank you.
Thank you so much to all our panelists and all your vulnerability with your stories and all the work, amazing work that you do and continue to do. So thank you so much. I just wanted to set up a reminder. I wanted to say thank you I wanted to repeat thank you for your vulnerability to all our speakers and for all the continued wonderful work you do. Just a reminder that we are having our raffle, and there should be a link in the Zoom chat. I know that we were taken down off of Facebook Live, but we did set up a YouTube Live, so the links for those will be posted in the chat here and on Zoom, as well as the chat on YouTube, so you can sign up for the raffle. But yeah, thank you so much, panelists. Thank you so much, Joanne. But we'll be moving on to our second session, which is on the ChicagoCHEC partnership and the lessons learned. So through the dedication and work of ChicagoCHEC's Community Steering Committee and community partners, ChicagoCHEC has made many achievements since 2015 and has gained many valuable learning lessons. Here to share some of these highlights with you are ChicagoCHEC Community Engagement Core co-leaders, Ida Giacello, who is an educator and a writer and uses research for community mobilization to address health equity and social justice issues, as well as Dr. Janine Tahira-Geza. So you guys could go ahead and get ready. Go ahead and get started whenever you're ready. Thank you so much for being with us.
Good morning or good afternoon, I guess. First of all, I really wanted to commend all the speakers and all the remarks and testimonial given this morning. They have been they're amazing, and they have been extremely inspirational, at least for me, because I also have been going through cancer journey with my father who died of liver cancer, my brother who died of pancreatic cancer, my aunt who died of breast cancer, my husband that died of lung cancer, and my daughter's husband currently is under radiation for prostate cancer. So I also know at the personal level the kinds of struggles and challenges, and your words were extremely valuable, and it touched me very deeply as I remember those experiences. I wanted to say that I'm going to be, and I don't see all the screen verbally, but I want to say that that I'm responsible. I was asked to speak about the partnership and give a very brief background of the kinds of what our partnership is all about. And I have the honor to also share the slides with Janice. So let me get started. Thank you. The next one, please. To begin with, I wanted, I guess it went out of order. I'm supposed to be talking about the purpose of the presentation. So let me begin by saying that the purpose of the presentation is to provide a very brief background of the ChicagoCHEC Health Collaborative and to share some selected achievement challenges and lessons learned, and to encourage you to join us in addressing cancer health equity. There's a lot of work ahead of us. And so verbally, I'm in the wrong, you have the wrong set of slides in the screen. Thank you. And while we get the right set of slides, let me say that as a Puerto Rican, you know, I have the tendency to speak fast when I have a lot to say. Sometimes I go too fast. Sometimes I mix my English with Spanish, or sometimes I speak a different language that is not English or Spanish. So bear with me as I do this presentation. The next one, thank you. So why is it that we are focusing on cancer-related issues? The testimony really gives the context about why we are so committed in really developing the partnership between community and academic entity, but also in really addressing the diverse need that cancer survivor or people at risk or those that are living currently with cancer are experiencing. When you look at this particular slide, you find that 68% of the city of Chicago population consists of racial and ethnic minority. The first slide, at least to my left, you have the cancer mortality for the entire city of Chicago, and different sections tell us where, the darker section tell us where the mortality is the highest. When you compare with the next map, which is about the African American, and the following one, which is about the Latino community resident, you clearly see how there is a strong association between cancer incidence and mortality, and particularly a problem in minority community. The last one, the map that you see there, also highlight the poverty level. So it's not only the racial and ethnic minority, but those that are poor, those are racial and ethnic minority that experience high incidence and higher mortality. And so that's one of the reasons why we focus in on this. The next slide. The other reason is that building partnership is very, very critical, because in partnerships since the 1980s, we have found out that it's a best practice. We've been developing community network partnerships in the area of HIV/AIDS, in the area of type 2 diabetes and asthma, and the list goes on and on. And what they have in common is the fact that you have multi-sectorial people representing different sectors from the community, from the professional sector, working together, trying to figure out how can we best bring our knowledge, our experience, and everything else, that our own personal experience, knowledge in many different ways, particularly community knowledge and cultural knowledge of those community, to be able to address the kinds of issues that are happening in our community. So ChicagoCHEC is community driven. Everything that we do, it really involves continuous daily consultation, including preparation of this PowerPoint. It was the community, the co-chairs working very long hours together with the staff and the investigator, trying to make sure that in this presentation we convey the reality about the community involvement and how they really care, and want to make sure that in every single detail that we do collectively represent our effort. The next one, please. So in addition to the community, we have the academic institution. So this is a very unique project because for the first time we have 3 universities coming together, Northwestern University, University of Eastern Illinois University, and the University of Illinois Chicago, and their cancer, comprehensive cancer centers that at least 2 of them have. And so this is a very powerful group of people that are sharing resources with the community, sharing knowledge, and really making sure that we, in terms of the ChicagoCHEC Community Engagement Collaborative, are not only expanding for maintaining our partnership throughout the years and engaging in meaningful education and outreach activities, and that we are, the community are providing the kinds of input in other areas of the ChicagoCHEC that has to do with research, as the research component of this project that we're not going to be talking about right now. They also need, a series of assistance in recruiting racial and ethnic minority and people living with cancer or survivor or at high risk. And we also need community input in the form of training our new generation of health professional at cancer center. The next one. So here, in terms of this background, what you see is a tremendous amount of activities in the area of community education, outreach. And in the beginning, we started by engaging in action planning, as we call it, getting people to get excited, to be able to conceptualize what exactly they want to make the impact long-term and short-term, and to make sure that we are collectively leveling the field where the community and the investigators and the fellows and many others are in the same level. The community bring a lot of the community knowledge and culture, and they bring expertise. They may not say the same kind of jargon that we may use in research, but their input are so meaningful. They're so bright. Their ideas so much targeted into the kinds of work that needs to take place. So there's been tremendous amount of work that we have been conducting, and this is our 5th year in the 5th community forum of this nature, and that's why we have so many collection of photos and activities that we have been able to comply throughout the year. The next one. Here is some selected achievement. On one hand, you have some charts that provide evidence about how we have been increasing our outreach and educational activity, either because we have planned or participated or supported over 150 community events. We have reached over 14,000 individuals and family. We have promoted cancer prevention and care at local community events. And here's a listing of the many kinds of events that we have been actively involved. From Vive Su Vida, Get Moving, that Esther Chamarela every year from the Chicago Hispanic Health Coalition put in place. Fiesta del Sol in Pilsen, that Esther was able to help us from Alivio, and many others. The Hope Fest in Humboldt Park, the First Lady Health Walk and Run 5K in Burham Park. Beyond October, Hope in Action in the near South Side. And then we also work in collaboration with elected officials like Congressman Danny Davis in his World Health Day picnic and parade. So this gives you a sense of the amount of activities that are taking place, the amount of people that are involved directly or indirectly with all our events, and the diversity of community that we are reaching out, because we wanted to be as fair as possible to make sure that our message, our word of prevention and care goes into the diverse community in question. Next one. And here are more photos, and I really want to thank again the staff, Beverly, Edgardo, Maggie, Melissa Martinez, and many others that were able, and Alicia, they were able to identify a number of photos from our archive that really support what we're saying. The particular flyer that you have there is about Screen Able, because we have been successful of reaching out to the disability community. And in that particular event that took place, it was a celebration of the wellness for women with disability. So we don't forget about our women that are having a particularly physically or mental challenges. Next. And so this is other photo that relate as well as other with the annual community forum. So we have planned and implemented, like I said before, 4 annual community forums. They have been attended by over 200 people in average. With face-to-face now is different because of the pandemic. We have developed a community resource guide because one of the many things that have taken place in our forum is that people tell us what are their needs, what else we need to do. And one of the concerns that were brought up early on was the fact that there was not a centralized location where they could find resources for people that are experiencing cancer-related condition. They wanted to know which agency are providing bilingual services or multilingual services in many instances. And so they really immediately, the staff and the investigator did a whole inventory, and that information is in our website, in trying to make sure that we, as we committed in the community forum to do that, that we actually follow through. And this is a wonderful resource guide that is updated every year as new services are modified and improved or increased. And we have been able to, in that process, to make sure that we do a reality check. And that's one of the things that I'm going to be mentioning shortly. The next one, please. So this is one of the things that I was getting at. One of the things that we are doing consistently since 2018 is what we call community check-in conversation. And they, when we were doing face-to-face, is really going to diverse community, having kind of a listen session, focus group type discussion, if you want to call it, but very informal, where we bring people from the particular community where we were at, and we were able to then find out what are your needs, what are the resources, what are the challenges, and start documenting to the many stories and information given to us about what are the areas of priority that the community check needs to follow through in terms of meeting their expectation, but also in addressing the diverse needs and concerns that the people bring to our attention. And so we have done that in English and Spanish. You have a particular slide as part of this slide that also talks about the conversación virtual con la comunidad, el impacto de COVID-19 en nuestras comunidades. And this is important because when the pandemic hit us, we had a whole bunch of activities planned for the spring and the summer month. We were all excited. We already had started the planning for this forum that was going to originally take place in one of the city colleges. And when the pandemic came, we had to reorganize. The staff had done a wonderful job in trying to learn about Zoom and the technical aspect and see how can we be able to come up with timing discussions and topic where we wanted to hear, and we have been documenting that very nicely, about people experiencing food insecurity, housing problem, people experiencing not knowing where to go, as it already have been articulated, because many medical centers and hospitals they were providing radiation or chemotherapy were not, had a temporary suspension of those services. So we were able to give an opportunity for the community to share those experiences and their thought, and to be able to figure out collectively, how can we be able to help them out and address the many diversity and bring them into the discussion, into problem solving solutions as well. And so the virtual, meetings, conferences has been wonderful, allowing us to reach out even to a larger audiences. The next one, please. And so this is where I'm going to be stopping because my colleague Jenny is going to be following up with this particular slide. And so Jenny, it's all yours in terms of you following up in this presentation about our achievement and lessons learned. Thank you.
Thank you. Thank you so much, Aida. I'm truly honored to be able to share some thoughts about the work that ChicagoCHEC is doing in the community and within the academic institutions. So this special, on this slide, I'm going to address achievements that are very special to me as a teacher and also as a faculty member at Northeastern University. So this is where we inspire the community and the next generation. ChicagoCHEC has inspired, mentored, and trained students and fellows aspiring to be community health professionals. This year, we had even a larger group because, again, as Maggie Nava, or Maggie, as we refer to her, she shared with us that, one positive thing that came out of the pandemic, this pandemic, was that we were able to add more fellows, which means more training and training the trainers who are going to share with their families or the knowledge that they get from the ChicagoCHEC training. So anyway, so the fellows and students visited community agencies. They were not trained in silos. They were involved in community planning events. They expanded community cancer awareness and knowledge. And they conducted cancer-related research using community engaged approaches. As you see, this was all the research that they were presenting at different events. And they facilitated the cancer screening and care. And they developed cancer resources and linked people to services. Again, the trainer that becomes the trainee that becomes a trainer. So it's been just wonderful to see that the impact is widespread because they take the knowledge they get and take it to their own families. Next slide, please. Thank you. And so again, here we show different photos of engagement where the training happens in the community. The trainees visit various communities, as I said earlier, but then they engage the community, which engages them for a very successful experiential learning. Next slide. Thank you. So while we have the qualitative and quantitative achievements that Ida referred to and I just shared with you, they happened they didn't happen without challenges. And so, the participation in partnerships is time consuming, but the reward is amazing. We know, as many previous presenters mentioned, there's a great need out there. We were able to see it on our, on our own, just from the the check-ins that Ida just shared, and many other opportunities. We were able to see that there's a great need. People at risk living with cancer, and cancer survivors not having, that have limited resources. So, and ChicagoCHEC is responding in amazing ways with a variety of programs. And then we have community diversity, which is of course an asset, but it makes the work more complex. And to tell you that it's an asset, we want to increase participation. Our next steps are going to be going for more people to be engaged in this endeavor. So we want to reach out to diverse socioeconomic, linguistic, and cultural backgrounds, such as Asian communities, Polish Americans, African immigrants, and many more. Next slide. Thank you. So with all of that, yes, we've learned a lot. We've learned a lot. We have become intentional about diversity, equity, and inclusion from the academic institutions and the community. We cannot do it without being intentional about diversity, equity, and inclusion. We have a shared vision of eliminating cancer disparities. With everything we've learned, we know we just have to work harder and fight, and ChicagoCHEC is committed to that. We are also committed to achieving health equity in cancer prevention, diagnostic, treatment, and care. And without trust, cohesiveness, and nurturing relationships, I don't think we would have been able to, ChicagoCHEC would have been able to reach the achievements that we shared earlier. And we developed communication systems all along, open and ongoing communication systems. We have established consistency and concrete activities that community members find beneficial. We have response left. We have had great feedback from the community and the academic institutions about how this, the activities have contribute to the growth, again, of our students, our fellows, and so on, and our faculty members also, in addition to the community members. We have ongoing partnership evaluation activities that assess the pulse of the partnership. And that has taught us a lot, of course, and that's what we use to keep growing and creating more programs and expanding on what we already have. And we have also shared resources, expertise, and created opportunities to learn from each other. And that's actually one of my favorites, because even creating this presentation, it was amazing to see the team coming together, one side after another, a picture after another. It was just beautiful. And our programs have built-in flexibility to adapt to changing environments, such as the COVID pandemic. Now we have, for example, check-ins virtually. So we are constantly adjusting ourselves. And that's, again, the beauty of bringing a group together. And ChicagoCHEC has done an amazing job that way. And more importantly, we have a strong organizational partners, staff, investigators, as Ida said, and other people. It's just, we can't do it alone. And that's what the definition, really, that's what ChicagoCHEC does beautifully. So from the communities to the academic institutions, it's been beautiful to watch the collaboration that's happening, that's been created. And let's hear now from our leaders. Next slide, please. So since our dear Henrietta and Joanne, Henrietta Barcelo and Joanne Glenn, the co-chairs, the CSC co-chairs, have shared beautiful words, and I'm going to give you a minute to just read them for yourselves. Just see how wonderful. I don't know if you can, maybe I should read it, maybe not large enough. So Henrietta says, cancer doesn't stop during COVID-19. It keeps hiding, attacking, growing in our bodies. We have to keep up on cancer health for our mothers, fathers, children, tías, tíos, y abuelos, and arm ourselves with information and resources that speak our languages and help us fight cancer when it strikes. I thought that was beautiful, really. And then Joanne says, time goes fast. And 5 years ago, when I attended the initial announcement of the NIH funding for the collaboration of Chicago institutions to focus on cancer equity, as a clinician and a respected community advocate, this presented an opportunity to serve, watch, participate, and keep our leaders, researchers, and academia in check. An opportunity, as the late, great John Lewis, as earlier Joanne shared with us, said that was your opportunity for good trouble, meaning if the community was not at the table, it would be concerning. To fast forward, job well done, check. Thank you, Joanne, thank you. Next slide. Yes, thank you. Then we have two other community leaders, Carmen Velasquez and Rosemary Rogers. Carmen says, the annual ChicagoCHEC Community Forum is an incredible forum for the on-ground sharing of those who have and had cancer and those who have been touched by cancer through their families and extended families, as we heard so many sad stories. So thank you, Carmen. And Rosemary says, since its inception, I have found the community forum has been a valuable tool for educating diverse populations that may not have been served before. It has provided culturally appropriate materials and given the attendees the opportunity to communicate, interact in a safe environment. Thank you so much, Rosemary. And again, I'd like to thank everyone. Next slide. I'd like to thank everyone for the contribution. First of all, for the audience to be here. Thank you for making it. We know there's so much going on out there, but thank you for making it to the forum. And then I'd like to thank the committee members who absolutely did a phenomenal job putting every piece together. It becomes even more complicated when it's virtual, a virtual forum. So thank you. I'd like to also again thank our community steering committee members and the co-chairs, Henrietta and Joanne. Thank you very much. Then the community engagement colleagues and staff, you all did a wonderful job. Keep up the great work. Thank you. And of course, with all this work, it wouldn't have been possible if there hadn't been the grant, the NIH grant for National Cancer Institutes, U54. Thank you very much. And for information, if you need additional information about the presentation, you may reach out to me and Ida. And then for general information about ChicagoCHEC, please feel free to reach us by email, website, Facebook, and Twitter. Thank you, everyone.
Thank you so much, Janine and Aida, for those wonderful words, and as well as sharing those wonderful words from our from some of our leaders. It was very nice. Thank you so much. As a former senior fellow for the ChicagoCHEC program and fellow for the research fellow for the program, I can tell you that the program is absolutely wonderful and that they are doing wonderful work. And it's definitely opened my eyes, as well as many other of my peers who have participated in the program, to the cancer outcomes, as well as like all the information out there. So it's a wonderful program. Thank you so much. Alrighty. Up next, I believe on the schedule, we have our raffle winners. So for the raffle, if you haven't already, I believe that Melissa has sent the raffle link again. So if you haven't already signed in for the raffle, please do so. It should be posted on both Zoom as well as, I believe we're live streaming on YouTube. So it should be on there. So yeah, thank you so much. But we'll be getting started with our raffle winners. Oh, awesome. All right, so I have received the winners. I wish we had a drum roll, but for our first winner, we have Nemo Talahi Adebayo. Congratulations. Nemo is actually also a prior research fellow, so congratulations, Nemo. And our second winner, Nemo was number 109, and then our second winner is Evelyn McGee, who's number 50. Thank you so much to everybody who participated in the raffle. But those are our two winners, Nemo and Evelyn McGee. You will be contacted for the raffle. Thank you so much. And then before we let you out, I do want to say we have a couple closing remarks. I want to say thank you to everybody. Thank you to all of our speakers, our community partners, and thank you to you, all of the attendees, for making day one of the 2020 Community Forum a success. Please join us tomorrow for day 2, which will focus on health and well-being for those being touched by cancer and the use of telehealth during COVID-19. And also a reminder that tomorrow we will also be holding a raffle similar to this one. So don't miss tomorrow. Tomorrow's gonna be filled with a bunch of more interesting information, so be sure to tune in tomorrow. But now it is my pleasure to introduce Dr. Allison W.O.T, Commissioner of the Chicago Department of Public Health. So thank you so much, Allison, for being with us, and you can go ahead and get started whenever you're ready.
We might need to give Dr. Wardy a few minutes to get connected. I know we had her scheduled for 12:50, so we're a little bit early. This is Alicia. I just wanted to thank everyone again for coming today and participating in today's forum. Us as staff, we've been so excited, counting down the days, anxious for all of you to see all of the wonderful work that we've done to put this event together. Excuse me. And so also we just wanted to mention, we know we've packed a lot of information in only 2 hours. So one thing that we're doing with both today's agenda and tomorrow's agenda is some of these topics we'll be elaborating more in our virtual community conversations. And so we will be having that information posted on our forum website and on our ChicagoCHEC website regarding what topics and which months we will be doing our sessions and elaborating on some of this information that we have been presenting today and we have upcoming for tomorrow. I didn't know at this time if Dr. Wardy has joined us. Perhaps not. Has anyone in the audience have any questions at this time regarding either of the sessions that we'd like to go through?
I see Dr. Simon's hand. Dr. Simon, you can go ahead.
I just wanted to give you all a shout out. You all are amazing and truly inspirational, and thank you for everything. I also want to give everyone who took the time today to be here a big shout out and thank you. I want to emphasize a few big things. Vote. I can't emphasize that enough. I can't tell you who to vote for, but I want you to vote. Everybody's voice counts. If you're able, please, and get your friends and family. We need as many people voting as possible in this election. Our voice really is needed now more than it ever has been in our lifetimes. So healthcare is on the line. COVID is on the line. A whole lot of things are on the line. And finally, I wanted to encourage, in the spirit of Wakanda, really, cancer screening is going to get left behind as we're ensconced in COVID. And I want to make sure that you understand that all of us around the city are still operating clinics and still doing cancer screenings and follow-ups. And please don't forget, don't delay that cancer screening, whether it's colorectal or breast or cervical or any of them. Please, lung as well. Please get your cancer screening or reach out to your healthcare provider. Thank you.
Thank you so much, Dr. Simon. Yeah, it's very important to vote. Everybody go out and vote. As we can't tell you who to vote for, but it's important that you just go out there and vote. And amidst all this COVID-19 going on, we want you to make sure like cancer is still an issue and it's definitely should be at the forefront, even though COVID has seemed to taken over everything. I did see one hand. I don't know if Selena Roque, if you had a question still.
It was an accident, but thank you so much, all of you, for your time. I am so grateful to be here and to be a part of this, and I am very much looking forward to everything that happens tomorrow as well.
So I have a question. Joanne, how does one get involved with your butterflies if they're interested in pursuing that kind of wonderful relationship and organization, that wonderful tightness that you have with your ladies?
Absolutely. Thank you for the question. We'll find you, but you can go to W.O.T, W-O-T. You can email me at, I'm trying to think of the best email you can do. You can just do W.O.T Foundation@yahoo.com, or you can call me at 312-391-2929. Again, 312-391-2929, or email WOTFoundation@yahoo.com, and we will connect you. Thanks.
Do we have questions from the audience? Please unmute yourself and ask the questions. Thank you.
I have put down the email for you, Joanne, if that's okay. I put it down in the chat for everybody to see.
Thank you. I just want to echo what Dr. Simon said as well. The voting is critical for healthcare, for the next levels, and for survivorship. So don't think that everybody's voting and you don't have to, because we need your vote to count. And take care of your health, so be well.
Thank you so much, everybody, for the additional comments. I want to welcome Dr. Awadi on the floor. Ever, did you want to go ahead and introduce her?
Yes. All right. Thank you so much for being with Dr. Addison Awadi. Dr. Addison Awadi is the commissioner for the Chicago Department of Public Health, and she's here to give our closing remarks. So go ahead and get started whenever you're ready, Dr. Awadi. Thank you so much for being with us.
Of course. Thank you. It's so nice to see some faces I know. And, you know, I've really been enjoying hearing the parts of this where I've been able to. Obviously, I think the focus, you know, for this conversation at this time, thinking about how cancer work relates with COVID, this is what I think about all day, how all the things within the health department that we have long cared about and long worked on, how do we take this moment of COVID where people are thinking about health and health inequities and prevention and chronic diseases and environment and, you know, all of these pieces together. How has COVID-19 brought this to the forefront? And what do we do to push the things that we want to push with this slightly new lens? And I really have appreciated, you know, hearing how folks are thinking about it in this group and others. You know, first, I do obviously just want to congratulate ChicagoCHEC on the 5 years, the work that you've all been doing to advance health equity. I really call out the leadership there that have brought this particular framing to the conversation in such important ways. And I really, whenever I see, you know, multiple institutions really coming together around an issue, I love it, because it means that we're all rowing together, and rowing together, especially on issues like cancer prevention and making sure that everybody is getting the access to prevention, the access to treatment with a very community involved component is absolutely key. Some of you may know that later this afternoon, the Chicago Department of Public Health is actually finally launching our virtual Healthy Chicago 2025 plan. And I know many of you on the call are already aware of that. It was meant to launch back in March and April, and obviously did not happen at this point. So we're doing a virtual launch 2:30 to 4. So if you're still hanging in there for some Zoom, feel free to join us. It'll be streaming on our Facebook page, or you can go to bit.ly/Healthy Chicago 2025 if you want to register. But in case you don't know, the whole focus for Healthy Chicago 2025, which was developed with hundreds of partners, including many of you and your organizations, is focused on the racial life expectancy gap here in Chicago. And we very specifically talk about especially the fact that Black Chicagoans on average live 8.8 years less long than other Chicagoans. That gap is specifically to white Chicagoans. And we're seeing life expectancy drop for the first time here in Chicago after decades, but we're not seeing it drop among white Chicagoans. We're seeing it drop among African American, Latinx, and Asian Chicagoans. And this is preventable. This is absolutely something that we can work on. And so much of it has to do with the root causes. So we'll be talking in some more detail if you join us, but I did want to highlight actually how cancer plays into some of those stats. So in that 8.8 year gap, almost half of it, 4.3 years, is what we call chronic diseases, which we sort of pull together the diabetes, the heart disease, the lung disease. We specifically call out the fact that smoking-related illnesses are 2 years of that gap right there. And then I did have the team pull specifically related to cancer and what we know about sort of at that city level. how much of the gap is being driven by cancers. And broadly speaking, so in this 8.8 year gap, 1.2 years of that gap is related to cancer. And this means this isn't just the amount of time people are living, it's the difference between how long Black Chicagoans and Chicagoans of other race ethnicities, and especially white Chicagoans, are living. And that's 13.5% of the gap right there. And if we break it down further, lung cancer is 3.2% of the gap, colorectal cancer is about 2%, breast cancer is just under 2%, and all the other cancers together are about 6%. So working on this, the exact things that this group is focused on are crucial if we are all together going to be thinking in a long-term way about building a healthier Chicago, and one that is honest about talking about the long history of inequities and the ongoing systemic, institutional, racist systems, policies, ways people interact with the world, and work to correct those in every way that we can and try to be honest about speaking about them. So we are absolutely thrilled to see the collaboration that's happening with so many community partners. Chicago Department of Public Health wants to do whatever we can to help support this group. The important work that you're doing with community residents related to follow-up and recommending screenings, making sure cancer survivors are linking into support and treatment, thinking about how, when people are affected by cancer, not just the immediate cause, but what does this look like in the long term? How do we grow from this? How do we build community? And I really thank everyone involved in this, whether you're academic leaders, community leaders, civic leaders, community members, students. I know there's a lot of voices in this. CDPH really stands with you in this vision. Thanks to everybody who joined today. I know there's going to be much more interesting conversation tomorrow. And I really encourage you, I'm going to keep using this moment of COVID to try to raise the voice of public health, of healthcare, particularly around issues of inequity. COVID here in Chicago, 48% of our cases have been in Latinx, Latino or Hispanic Chicagoans. 43% of our deaths have been in African American Chicagoans. That has gotten attention. And that same disparity, which is due to all of the root causes that underlie why that has played out, are those same root causes that underlie the things that you're working on related to cancer. So thanks again to everybody for the work you're doing, and please be in touch if there are ways that the health department can partner and support. And let's all, I heard the recommendation to vote. I would say absolutely also fill out your census pretty please right now. And then let's keep working together and really aim toward what will, once we come out of COVID, I'm confident that continuing this conversation is going to be important, not just for cancer, but for all of the inequities that we're working on here in Chicago. So thanks again very much. Congrats on a good first day. And I hope that the conversation tomorrow is just as successful.
Good. Thank you so much, Dr. Awadi. While you were speaking, I did see that there was a hand raised. I don't know if that was a question for you, but Denia, I think you had your hand raised. If you have a question, you can go ahead.
Buenas tardes, mi nombre es Denia Perelló y lo único que yo quiero agradecerles a ustedes por tan excelente información, en especial, ¿verdad? Nosotros que somos sobrevivientes de cáncer. Yo soy sobreviviente de varios tipos de cáncer de seno, de cáncer de pulmón, cáncer de ganglios linfáticos y tengo 2 operaciones de corazón. Y gracias a Dios y a todas estas charlas, todas estas presentaciones, estas ayudas que ustedes nos dan, pues gracias. Yo sigo adelante en esta lucha y estoy muy contenta de pertenecer a Chicago, ¿verdad? Al grupo, a la organización Proyecto Resurrección, a mi grupo de sobrevivientes de cáncer que se llama Ellas, en la lucha a sobrevivir, y sé que de todo esto que ustedes nos están informando a nosotras, vamos a sacar muchas cosas positivas, ¿verdad? Y pues yo en lo personal quiero decir, ¿verdad?, que todas las personas estamos en riesgo de tener este COVID-19, pero especialmente las personas que somos vulnerables a esta enfermedad, que nos cuidemos, ¿verdad? Que si salimos, usemos nuestra mascarilla, ¿verdad? Y cuando lleguemos a nuestros hogares, por favor, que las demás personas usen su mascarilla, que nos lavemos las manos, que nos bañemos, que tomemos todas las precauciones, ¿verdad? Porque esto va para largo. Pero gracias a ustedes, gracias ante todo a Dios, porque aquí nos tiene y seguimos adelante. Así que mañana estaré aquí porque me encanta mucho informarme y seguir todas las recomendaciones. Gracias.
Muchas gracias a usted.
Muchísimas gracias. Yeah, and as a translation, Denia is a double cancer survivor, and she wanted to just say thank you to the commissioner and then all the speakers for the wonderful information. She is part of the resurrection group called IHSCA, and she wanted just to keep in mind that everybody, just to be careful, everybody's suffering from COVID-19. It's a real problem, but also those who already have coexisting diseases such as cancer are also at higher risk. So make sure you take care of yourself, wear your mask, use hand sanitizer, and make sure you take those precautions. But thank you so much, Denia. I hope I'm pronouncing your name right, but muchas gracias. And I believe, I don't see any other questions, so I believe that is the end of our forum for today. Please be sure
I
to-
have a question. This is Aida, I'm sorry.
Go ahead, feel free.
Well, first of all, Dr. Wardy, thank you so much for accepting our invitation and for the wonderful remarks, because you are so much aware and is providing leadership in mitigating COVID-19. Can you be specific and share some of the strategies that you're currently engaging to minimize the impact in the minority community, particularly African American and Latino?
Sure. So, that in and of itself is probably a 45-minute conversation, but at the highest level, I think one of the things that we really, from the very beginning here, at the direction of the mayor, very early on started really focusing on racial and ethnic, disparities in terms of outcomes, but we didn't just want to present data. Like right from the very, just a few weeks in where we were seeing, especially early on, very hard hit COVID in the African-American community. We did pair this with what we called a race equity rapid response team. And that was a collaboration, from the Chicago Department of Public Health and the mayor's office, but it's pulled in many voices that are based in communities. So yes, there is a group of providers, medical providers, but more than that, there are clergy, there are folks from like different community-based organizations, people who are activists, have particular points of concern, and importantly, we specifically have focused, made that group really the decision-making group in many ways. That group helped really define what our dashboards would look like, what kind of data were we putting out, what kind of language would we use. Epidemiologists very much like to talk about rates, this many cases per 15,000, whatever. That is not necessarily language that is as usable. And so really, this group said, okay, you can have rates on there, but put them low. Turn it into language where I can say today, 1 in 4 Chicagoans has been tested for COVID. 1 in 37 Chicagoans has been diagnosed with COVID. Where we've set up our dashboard, and if you want to see this, you can go to chi.gov/COVID-. You can hover, if you go to the weekly view, every single week, you can hover over your zip code and see in my zip code, how many tests, how many people have been diagnosed, how has that changed, really trying to first of all, present data in a way that people were letting us know this is what people are wanting to know in my community. And then really with that group, every single week, we have worked to push resources to whatever area in Chicago is having the biggest issue with COVID. So every single week, we redo our strategy. Wherever we're seeing surging cases, increasing positivity, any concerns, we drive mobile testing, we drive additional outreach strategies. There's like a 23-point sort of plan that we go through, but it's all being done really through these community groups. So the health department says, here's data that says this zip code is the zip code where we're particularly concerned about. And then our many community partners are the ones saying, okay, in this zip code, this is the church, this is the group, this is the corner, this is the place where you need to put the resources. Here's what we need differently in terms of education. Here's where we want to partner, you know, the health resources with these trusted voices in community. We're, you know, this is a learning process every single week, always trying to figure out how can we improve on that. I hope that this will just continue to get better, but I think we have really tried to be the provider of data for particularly for this kind of community-based, very local outreach and intervention strategy, and then allowed that to really be driven every week by where the needs are, pushing resources where the needs are in a way that folks who live in that zip code or community tell us will be most effective. So just fundamentally, I'd say that's one of the overarching strategies that we've been using and that I hope to really continue to expand on and grow. We've also worked to push a lot of resources and fund community-based organizations and clinical FQHCs and other providers. Think about that partnership in a way that if folks are doing that work for us, there also needs really to be some funding ideally to make sure that that's being supported well. And again, just trying to get everybody rowing together. Like there's a lot of opinions and a lot of thoughts, but having a very race equity focused lens on COVID from the beginning, I think has been a strength for us. It has kept the conversation focused around long-term investments, fitting into some of the mayor's plans, fitting into our Healthy Chicago 2025 plan. It's a harder conversation in some ways, but we think it's an appropriate one. So check out our website, chicago.gov/coronavirus, if you want to learn more about the details. But this, you know, really trying to figure out what is true community engagement and decision-making. What does that look like? How can we continue to improve upon that? In my opinion, is how at the end of the day, we're going to win this thing. People wanting to do the right thing, to the point of the last speaker, wearing the masks, doing the things that work, is an individual decision at the end of the day, as much as it is any law that I pass, any order that we put in place. And really feeling like I am part of the solution to COVID is about feeling like the messaging is speaking to me and to keeping my community safe. So that's one of our overarching strategies. Thanks.
Thank you so much, Dr. Awadi. I want to be conscious of your time. Is it okay? Can you stay for one more question? I believe we have one more question. Alrighty. Esther, Corpuz, you can go ahead.
Hi, Dr. Awadi. Thank you for participating today. I am on the provider rapid response team, and we are convening a meeting. We invited CDPH. We're really concerned about winter testing, and you know, what strategies do we have to continue our testing efforts in Chicago with cold weather? And the second is flu shots. We were hoping that you know, we could offer free flu shots to everybody, but I understand that the city has a shortage and only has like 20,000 vaccines. Can you speak to that?
Sure, and certainly there will be more, you know, there's a lot of work happening on both of those, so we'll have some more opportunity in that forum to talk details. You know, there's a whole team working on cold weather planning, because cold weather planning is not just about testing, it's actually thinking about the vaccine campaign too. We're trying some things with our flu campaign that we're hoping to transition to the COVID vaccine campaign once it's available. We're thinking about even things, you know, people have gotten used to this concept of drive through or sort of walk through testing and social distancing. What does it look like to potentially try sort of a drive-through vaccination strategy or a drive-through and get out? How do we keep things warm? How do we think about this? Certainly, we think the mobile strategy is a good one. We're exploring some more opportunities for, you know, sort of van type, smaller number, where there's more flexibility and fewer people, particularly around the testing strategy. And we're working with very large spaces in Chicago, whether those are our community colleges, some of our big high schools, even some of the park district sites that offer large indoor spaces that can have good ventilation and safe, both for testing and for vaccine. Related to flu, so the city of Chicago purchases flu vaccine doses, just as we do every year. And we push those, you know, again, where they tend to be most needed, a particular focus on folks who are uninsured. In addition to providing direct flu vaccine, we also are we work with, you know, a lot of the pharmacies around making sure vouchers are available. You know, flu vaccines tend to be very, very well covered for anybody who has insurance. And so particularly for people who are insured, we very much are encouraging people, first and foremost, you know, get your flu shot through your health provider. That's always our #1 message. Heading into fall and winter especially, we would really like people to be connected to a healthcare provider. Especially if they have any underlying condition or if they are older. We know that as flu season comes, people are going to be getting symptoms. Is it flu? Is it COVID? There's going to be a lot of worry and a lot of testing need probably and decision making. And the more we can make sure folks are connected to providers, the better. So we've actually been pushing kind of first and foremost, like now's a good time to make an appointment, you know, with your health provider for your flu vaccine and to make sure that you have any of your chronic conditions and things sort of in line right now while we're in good control. We also are pushing pretty hard on pharmacies. Because they will be a big part of our campaign strategy, even for COVID vaccine when it becomes available. We have sort of an all hands on deck plan that includes providers and pharmacies and clinics and stand up and all sorts of things. And so encouraging people, you know, CDPH will be offering some, but we'll be doing more pre-registration as opposed to walk up like we've done previously. That's also similar to more what we'll have for COVID around having separation. So we can say more when we meet, but I think broadly, we obviously want a very good flu uptake this year. CDPH will have some of this available, but we'll also be working with vouchers, pharmacies, and providers, and with a particular focus for the health department on those who are uninsured.
Thank you, Dr. Aguadi. And we, you know, as FQHCs don't have the luxury of a big gymnasium or, you know, so we want to continue to do testing. So we don't want to figure it out in a vacuum. We really want to do this in collaboration with the city.
Yeah.
Because, you know, we're doing so much testing right now. We hate to just, you know, stop testing because of the winter, because of weather.
Right. And I think it's about thinking, you know, there's the testing that can happen within regular clinical settings versus some more of the like mass testing pieces. And, you know, CDPH at this point is actually doing about 1/3 of the COVID testing that's happening across the city every day, which is not, it's a lot. It's actually not necessarily our ideal state because we're seeing people move from providers sort of to more of these roll throughs, and we're working hard to make sure people are ideally connected back, right? Like so that this testing is connected to clinical providers. So, you know, you're probably aware we released some new funding that we offered to all the FQHCs in the city, and 19 of the systems took us up on it to have some additional funding, you know, to think about what does support look like around testing, case investigation, contact tracing. But I think that COVID testing, they're sort of in the clinical setting, you know, will continue to be something that we very much want to support, especially in FQHCs, while we pair that with more of the mass type testing.
Thank you so much.
Yep.
Thank you so much, Dr. Awadi, and for all those amazing questions. But yeah, we are wrapping up day 1 of our community forum. So I just want to reiterate, thank you to all our speakers, community partners, and to all the attendees who were able to make day 1 of the 2020 community forum a success. Don't forget to join us tomorrow for day 2, which will focus on health and well-being for those touched by cancer and the use of telehealth during COVID-19. And I do believe that Alicia did post the link for the event that Dr. Awadi was speaking about. It's from 2:30 to 4 p.m. So if you would like to go ahead and join in on that, the link is in the chat for Zoom. And I believe you just need to register and the event will open up at 2:30. But yeah, thank you all for joining us today, and we hope to see you tomorrow.
Thank you.
Thank you, everybody.
Bye.
Thank you.